All right, I think we're live. Do you see live on your end? Okay.
Yep. I see it.
Yay. Okay, I'm gonna check and make sure that I can see us on Facebook. Yes, there we are. Okay, we are live. So I'm gonna keep an eye on your comments. So as we talk to Robyn, you guys can put questions in the comments or whatever you want to do, and I'll go back and look at them. And at the end, we can see if you have any questions. Okay, she might answer all your questions before we can get there, but we'll see. So thank you, Robyn, for hanging out with us tonight.
Yeah, absolutely.
Really appreciate it. Let's see, I'm gonna turn my volume up. Okay. So Robyn is a local doctor. She is my chiropractor. She's fabulous. So I wanted to just have Robyn introduce herself first, and then we'll get into some topics. So tell us about yourself. How did?
Hi everyone. You there?
Yeah.
Yeah.
Go ahead.
So I'm Robyn Hawkins. I am a local chiropractor here in Augusta at Magnolia Chiropractic. I co-own the office with another doctor. We've been open going on 2 years now, so that's super exciting. We were both associates, in North Augusta, and so the opportunity came open for us to kind of open our own office, and that's how we started that. So it's been awesome. But I know I've met so many great people, and I'm happy that you're at the office now, and so yeah, I meet a lot of really cool people, especially moms, a lot of moms. So
Yes.
I do mainly work with a lot of moms. I see pregnant moms, kids. We are like a family focused practice. So it's a lot of fun. I love it.
That's so good. So good. Okay. So we're just going to dive right into it. And Robyn's going to tell us a little bit about like the benefits of chiropractic care, and maybe, some obvious benefits, that maybe some indirect benefits that we may not realize. So give us a rundown of the basics of that.
Okay. So obviously everybody, when you hear chiropractic care, you think pain management, to help with low back pain, neck pain, headaches, that type of thing. And it does. Don't get me wrong, it does help with those things. And we see that daily, people coming in with sciatic pain or migraines, things like that. But there is a lot more to it. And I didn't realize that until I actually went to chiropractic school. And so basically the rundown is that you have nerves that exit the spinal cord in between each bone, each one of the bones in your spine. And those nerves go to every part of your body. So people don't realize that, the nerves that go to your heart to control your blood pressure, the nerves go to your stomach to digest your food. Every bodily function is controlled by those nerves. So just making sure that the spine is properly aligned, it just makes sure that there's no pressure on those nerves. And that way you have, a good message from brain to body. So with that being said, it is good for, overall health too, just to make sure that, your spine is properly aligned, everything's functioning the way it should. And then obviously with that comes, just better health. People notice that they sleep better, they're able to, kind of better cope with stress, those types of things. So that's kind of the less obvious, the things that people don't usually know about, that's really eye-opening for sure. So
yes,
it's crazy.
So that's really interesting about the nerves on the spine. So does that mean, like, if you have a specific pain in a certain part of your back, does it affect a specific area of your body?
It can, yeah. It's called the autonomic nervous system for anyone that loves to Google or look up on YouTube. And I have a really big poster in my room too that shows basically the spine and each segment and then what that goes to. So, what organs or whatever that nerve goes to, and then possible symptoms related to that. So it is crazy, and it's not always your catch-all, but it is good to check just to make sure, especially if you're dealing with something in particular. If you feel like you've tried everything else, I definitely would try chiropractic care for that for sure.
Yes, definitely. Yeah, I started going to the chiropractor, I think it was when I was pregnant, because
Yeah.
I had so much lower back pain and there was just no relief. And so I found a really good chiropractor that, knew what he was doing with pregnant women at the time. But that was what got me started. And I was like, wow, this really works. And it really does help. So thankful. Kevin and I were both so thankful to find you, because we both needed someone to more consistently go to. So, so here's a question for you. Is it safe, like, for everyone? I know you talked about moms and kids. Like, would you say it's safe for everyone?
Definitely. I know, and I feel like that's a big misconception is that people think, oh, I've already had back surgery, so I can't go to a chiropractor, or I have really bad arthritis, or I'm pregnant, so I can't go right now, or my baby doesn't need chiropractic care. I feel like those are the things that we see the most. But even with back surgery, even if you have hardware, we may not necessarily be able to adjust that segment, but we can adjust above and below, and people notice a lot of relief with that. Arthritis, we still use really gentle techniques, so you're still able to get adjusted and usually see relief even with that. And then definitely with pregnancy, that's honestly my biggest group of patients, is pregnant moms. It's just so beneficial for both mom and baby. For the developing baby, to make sure that the pelvis is aligned. It's just great for pregnancy, and then it's into labor and delivery. And then for babies too, I know some people are like, how do you adjust a baby? But it's nothing like what you would picture for an adult. I literally use my pinky for newborns, and then my index finger for kids that are up until maybe age 3 or so. And then I can use the little clicker, which is really gentle. So yeah, most, especially babies, sleep during their adjustments, or mom's just holding the baby. So it's really neat. I love seeing little kids. So
Yeah.
yeah, there's really not one group that I would say no, definitely no chiropractic care. I think that anyone can really find it beneficial. We may just have to, it's a little bit more, that's where the personalized care comes in, is really looking at your history and what you have going on, and kind of working with that. So that's what's important.
Mm-hmm. Yeah. Okay. And so, like, leading into that, let's just talk about what, like, if someone decides, okay, maybe I should just try it out and see if it's good for me. So what could they expect? Like, I know all chiropractor offices are different, but like, what could they expect coming into your office to experience?
So definitely, the first visit usually does take a little bit longer, but it's just because we like to really get to know our patients, really figure out what's going on with them. We like to get a lot of details just to know exactly what you're dealing with. And so then we do, an exam, but that's just like range of motion, actually feeling the spine. And then we do have the option to take x-rays in our office. So that is really good. It kind of takes the guesswork out, especially if there's a certain area that you've really been dealing with. We don't have to refer you out for x-rays. We just take you in the other room, take them, and then I can show you exactly what's going on. So we do that. And then the adjustments, which I know everyone has different ideas of that. And I know you can speak to that too, that we don't really do a whole lot of like twisting and turning, or some of these crazy YouTube things that you see now. It's all super gentle, and the patient just has to lay there and relax. You don't have to do anything special or anything like that. So
Yeah.
does that help?
No, for sure. Because I've been to several different kinds of chiropractors, and some of them do that like manual adjustment where they're like twisting you. And that's, for me, like, I'm okay with that. As long as it's a good chiropractor, I don't mind the manual techniques. But especially if someone's very hesitant to do that, like the way that you do it is very good. And so you have like a table that I lay on face down. And then, you assess where I'm at right now. And then you use like a little clicker thing. And I don't even know what it's called. But
Activator.
what's it called?
Activator.
Debater. Okay. And so it's very like, I don't want to say hands off, but it's very simple and gentle. And you really just lay there and then you assess it again and make more adjustments. Oh, shh, shh, shh. I'm sorry.
Excited.
More adjustments if needed. There's Stuart. Okay. Shh. Oh my gosh.
Dogs can get adjusted too. I don't see animals,
Really?
but they can.
Do you do that?
Yeah, I know people that's what they specialize in after they graduated. They have like
Hold on. Just
animal offices or only see horses. It's pretty neat.
sorry, we're getting the dog under control.
You're good. He's just excited about chiropractic care, that's all.
Too much for him. Okay. All right. I think we're okay now. You good? Okay. He just hears like a little noise and then he's gone. That's funny that I didn't even know that they did, pet chiropractic care. That's great.
Yep.
Okay. What else did I want to ask you? Let's see. Oh, and so some people would ask probably like, does it hurt? Is it going to be painful?
So I always tell everybody it's typical if you're sore, especially after your first adjustment, but it's kind of like after a workout type sore. And some people aren't sore at all. It just really varies with that. A lot of it has to do with how much inflammation you have, how tight your muscles are, that type of thing. But most people know they don't experience any pain during the adjustment. They may be a little tender in certain areas or, have a really tight muscle, but no, it's not something that, it's unbearable the whole time while you're getting adjusted. I've had people start snoring before. So it's super relaxing for a lot of people. No, it's not, super painful or anything. So
Yeah. And if you've ever had a massage, you understand what Robyn means about just being a little sore afterwards. And it's not a bad sore. It's just, oh, wow, something really, something got worked in there for the better, Okay. And then, so another question that comes up a lot, and I think this makes people hesitant to go to the chiropractor is, like, if I start going, do I have to go like all the time?
So the best way I explain that is no. I mean, obviously you don't have to go all the time. A lot of it is that our patients, once they get adjusted, they just notice a difference in how they feel and they notice that they feel so much better. And so then it's like, whoa, I'm gonna feel like this all the time. So it's really more of keeping up with kind of that maintenance care. It just helps to prevent you from having all these injuries or waking up one day and your back gives out on you. I always tell everybody it's similar to going to the dentist to get your teeth cleaned every 6 months to prevent cavities. Same concept. So no, it's not that you have to keep going. It's just most people really enjoy how they feel with getting adjusted, and then they voluntarily choose to kind of keep up with that maintenance care. So, but yeah, at the beginning, we do have, treatment plans, but it's still nothing crazy. We don't have you come in for, 30 visits or something. It's very doable. And our goal is to get you on to maintenance care as quickly as possible. So that's the goal, is we want you to hold those adjustments for as long as you can. So it's good. I always tell my patients, I'm like, it's bittersweet if I don't see you. Like, I love to see you, but I know if I haven't seen you in a while, that's a good thing. That means you're feeling okay. So yeah.
Yeah, exactly. And like you said, it does just depend on the individual patient, like, and how much they need it or how little they need it. And that you encourage people to listen to their own body and not one size fits all. I appreciate that, because I have experienced some chiropractors that are just like, have given me this whole plan of, I need to come all the time. And they give like other chiropractors a bad rap, I think. And so I appreciate you and other really good chiropractors that listen to your patients and let patients listen to their bodies and go with that method. So find a good chiropractor. If you are not local, I think the best way to find a good chiropractor is through referral, like through your friends or family members that have gone to the chiropractor. Would you agree?
Yeah, definitely. And chiropractors, I don't think people are aware of this, but it's a huge network of chiropractors. So, like, I'm on Facebook groups with people from all over the country. I'm on one that there's people that are worldwide that are chiropractors. So, I do have patients that move or whatever, and then I'll post in those groups, hey, who knows a really good chiropractor in this zip code? So that's one really good way to make sure, because all chiropractors are different. Not that that's a bad thing. It's just kind of hard to know that who you're choosing, it's similar to who your relatives have seen or who they really liked. And so that's a good way, is just, asking people that that already go to a chiropractor, if they can reach out to theirs and see who they know where they're at. So
Excellent.
we're all connected. It's crazy. And in chiropractic school, my best friends, they're now in Pennsylvania, New Jersey, Ohio, and Indiana. So we know people from all over. It's crazy. Everybody's all spread out.
You just stay connected, right?
Yeah.
And it just grows and grows. That's awesome. Okay. So let me just check. We might not have any questions, and people might hop on later with questions, and and I'll get you added into the group, and that way, if there are questions later, then you can answer them.
Okay.
Yeah, I don't think we have any questions right now. Man, Facebook has these huge delays right now. And so a lot of people probably haven't even gotten a notification that we're live. So Facebook is fun. Okay.
I know it.
Did you want to add anything else? Is there a question that I forgot?
I think that's pretty much it. That really does cover, especially a lot of questions that most people have. So, and if people are local, I do free consultations too. So if you're interested and just want to, kind of talk in person and see, if you'd be a good match for our office or for chiropractic care in general, you do have that option too. We can just do a free consultation in person. Just sit down, kind of see your history and see if I think I'd be able to help you. So there's that option too.
That's awesome. Okay. And so that's what we'll do too, is in the comments, I'll put like your Facebook page.
Yes.
Do you have a website too, or just?
Yeah, we have a website, and I can give you that link too. And my Instagram username is the same as my Facebook one. So I can tag those in the comments too. But yeah, feel free to reach out to me.
Yeah.
Message or whatever if they have more questions too that they'd like to talk to me about. So.
Okay. Awesome. Thank you for taking time out with us tonight.
You're welcome. Thank you.
Really appreciate it. I hope that helped some people understand it a little bit more. I know sometimes it's kind of mysterious and people are afraid to take that step. So thank you so much. Have a good night, Robyn.
Thank you. You too. Talk to you later. Bye.